Hi, this is Dr. Padda. I wanted to talk a little bit about mindset and how important it is. A lot of patients sometimes get stuck. They get stuck in the present, and they think that everything in the past is what led to the present. And so they're constantly looking backwards and going, well, this thing happened to me in the past, and because of that I have this, this, and this, and this, and my present is terrible. And that's not how we should look at this, because the reality is the way the brain works, it's an interpretive tool. It analyzes your situation and it interprets, but you can affect its interpretation by looking at the future. If you look at the future and your future is brighter than your past and your future is brighter than your today, then it'll make a change. And what will happen is if your future has potential for great things and you're in the present, your past will start to look better. And that's the critical element. We reinterpret constantly our past based upon our future. And if we believe that our future is dismal, then our past is horrible and our present will be even worse. And so that's the thing. We need to reinterpret and look at our mindset about the past, the present, and the future, and realize that all interpretation of our past is something that we've created. It's not real. And I don't mean that it didn't physically happen, but the interpretation of it is how we make it. And what we make of it is what we anticipate the future will be. So what I really want my patients to focus in on is a brighter future, which will then help them reinterpret their past and improve their present, their today. Realize that a lot of times patients will use medication to insulate themselves from all of the things that have happened to them. And when they use these medications, they decrease the cognitive capacity for planning. They decrease the cognitive capacity to look into the future. And that can sometimes create a vicious cycle. And that vicious cycle then erodes their past and it erodes their present. And it keeps them from achieving the things that they need to do to move forward. At one point, the pain that you had that was severe was necessary because it protected you from an injury. But when chronic pain gets out of control and it becomes relentless and constant, then it no longer serves the original function to reduce your motion. So imagine that you're taking a walk and you get hit by a tree branch that falls. Your body tells you, hey, I've been injured and I need to stop movement, because if I increase my movement all of a sudden, if it's a critical injury, if I increase my movement, I might injure my spinal cord. So we stop moving. We get some spasticity, we experience the pain, and we have to analyze this situation. Now imagine if we've taken medication for a prolonged period of time and we can't really plan for the future and we constantly relive the past pain, then it's going to make our present dismal. That doesn't discount the fact that our past injuries affect our present, but our future positiveness will reduce the effect and the brain burden of the past injury. What we deal with is severe, complicated chronic pain, and it has multiple factors. This is just one of them. Another major factor is the neuroinflammation in your brain simply from the food that you consume. It's also the economic impact of an injury. It's also your relationships with other people. And we've shown repeatedly that loneliness is one of the major drivers of patients having unrelenting pain. And it also happens to be one of the major drivers of addiction. And the thing is that we don't really find addiction unless we also find loneliness. And a lot of the medications that we use for pain management can only compound the loneliness, the addiction, and the isolation. So these are all things that interact, and what we try to do in our pain management center is to look closely at these things and try to figure out how is it that we can help our patient achieve some degree of success and give them comfort. And sometimes that involves using medications and procedures, but also use other methods to make things better. If you have any questions, please feel free to reach out to me. We have basically a checklist on mindset and how your future really determines your past, and your future really determines your present. If you want additional information, we have that checklist below. Please feel free to download it. And if you have any questions, though, certainly reach out to me. This is Dr. Padda again. Thank you.